Thank you, Joe. Good afternoon, ladies and gentlemen. It's a great pleasure I have to be here to give a flavour, and from the perspective that I'm coming at as Deputy CMO and until earlier this week Director of Safety, Quality and Standards in the department, it will be largely a policy perspective, but flavoured with examples of the good work that's being done in Northern Ireland in terms of quality improvement. I hope you don't think I was too dismissive of the first slide there, but being Northern Ireland, people tend to fall into two camps around flags. Not the usual ones you might think, in that it's one camp that would want to bedeck every edifice across the country in flags, and the other camp that largely could live quite happily if they never saw a flag, and I tend to fall into the latter camp. But enough of that. One thing that does unite the people of Northern Ireland, however, is its support, interest in healthcare and the quality of healthcare. That's universal across the people, their political representatives and practitioners across the health sector. As Joe outlined, Northern Ireland is the smallest region in the UK with a population of 1.8 million. A relatively simple and straightforward organisational structure, certainly now since 2009, diagrammatically represented on the slide before you, which in essence shows the territory served by our 5 provider trusts which provide health and social care, overseen by a single commissioning body in concert with a single public health agency, and lorded over, dictated to, hopefully supported and directed by a government department responsible for policy, standard setting and legislation. There have been a number of recent policy developments of relevance to quality development, and I've itemised them there. But like everywhere else in the UK and worldwide, quality development didn't begin in the second half of the last decade. These initiatives built upon certainly a seminal policy document in Northern Ireland was Best Practice, Best Care, published in 2002. A key element of reform in 2007, when the beginning of the organisational structure I outlined, was a duty of quality on all health and social care organisations across Northern Ireland, underpinning through statute the need for everybody, every organisation and every individual working within those organisations to pursue quality and quality improvement as a statutory requirement. Key to pursuing that objective was the establishment of the Health and Social Care Safety Forum at the same time, and that body has been instrumental in taking forward the quality improvement agenda through the use of and dissemination of improvement science techniques, use of collaborative working to take forward care bundles, and the building of the faculty across Northern Ireland in terms of improvement science and collaboration. And there have been some very fundamental and practical successes as a result of that work, notably the use of the severe sepsis care bundle in emergency departments, where we now see as one element of that where 95% of patients now receive antibiotics within 1 hour of presentation. In other sectors, in the nursing home sector, we have seen a 25% fall in falls in those nursing homes participating in the Falls Initiative. A critical piece of the Safety Forum's work has been around the standardisation of care, the removal of unwarranted variations in the standard of care, and we have seen that exemplified in issues such as the regional maternity dashboard. Common early warning scores will be in place by August of this year. And we've seen significant work in building capacity across Northern Ireland, supported by the Safety Forum, through its links with IHI, its work on human factors training, its links with Queen's University in Belfast, and other links both north-south with the Republic of Ireland and east-west with the rest of the UK. So Quality 2020 is the key policy strategy document that now shapes the quality initiative across Northern Ireland. It was published for consultation in 2011, and the implementation plan post-consultation was launched in May 2012. We wanted to be ambitious. We want Northern Ireland to be recognised internationally, but more particularly by the people of Northern Ireland, as a leader in excellence in health and social care. There are 5 strategic goals underpinning the policy. None of those should be unfamiliar to anybody here in this room. I didn't have the privilege of hearing Robert Francis yesterday, and ironically speaking in Belfast this afternoon. If you're a conspiracy theorist, you might think it's working against us, but hopefully we'll get the opportunity. But my suspicion is, having read the report, or certainly significant chunks of it, these are the similar issues that confront the quality improvement agenda worldwide. It should be no surprise that these are the underpinning features in Northern Ireland, because to a large extent that's testament to how the policy was developed, and it was developed through a significant period of engagement with practitioners on the ground, with patients, service users, their relatives, and their informal carers. And again, a big lesson from Francis is these are exactly the people we should listen to in developing policy, in commissioning services, and in providing services. So a significant engagement exercise was undertaken in developing policy, and that gives the person who led that, who I know is in the auditorium this afternoon, is Jim Livingstone, and had he not retired back in October, would almost certainly be delivering this presentation today. And any of you know Jim, know that he's a very engaging fellow, so he was absolutely the right person to speak to people, listen to them, take on board what they said, and integrated that into the policy and the strategic goals you see there before you. And I'd like to thank and pay tribute to him. But it's all right having great goals somewhere off in the future. It has to be broken down into something meaningful over a period of time. In some regards, I put this slide in, failing to plan is planning to fail. Maybe a bit unfair in that these gentlemen actually did work with the end in mind, which was to have these beautiful bollards around the northern bank in Belfast. But some of their intermediate targets went a wee bit astray in that they hadn't really thought about how they were going to get home in the evening or get to their next job the following day. So setting something, a vision for 10 years hence, will be disrupted, set aside by events. So the implementation of the policy is deliberately and practically flexible, with a rolling programme of 3-year tasks, and indeed they are reviewed on an annual basis, each aimed at dealing with issues of culture, workforce development, measuring quality and its improvement, setting, revising standards, and integrating care, be that within teams, between professional groups, between care sectors, between carers and those that receive care. What's been the progress to date? 7 of the first-year tasks are underway and all due for completion in the autumn. 2 are already completed, particularly the managing safety alerts, which we now have a process in place that from departmental level to provision on the ground provides an agreed assurance standard across Northern Ireland, and the work is set to complete on those remaining tasks. Key to all of this is involvement. It's more than just consulting. It's about actively listening to communities and individuals. It's about inclusion of users in the design and decision around health services. That's key to delivering that vision. Have we been successful? That's questionable. Another reason I wasn't able to attend yesterday was that our Public Accounts Committee in Northern Ireland produced a report on the safety of services in Northern Ireland, and the headline in that was, "There is no evidence that health and social care services are safer for patients in Northern Ireland than they were a decade ago." We need to engage with the public in a meaningful way. Having said that, I think the Quality 2020 policy is the vehicle that will genuinely transform care in Northern Ireland if we utilise the commitment and talent of all those involved in care provision. Thank you.
So